What's up guys? Doc Reggie here, yung most approachable aesthetic surgeon na nagbibigay sa inyo ng kaalaman, katotohanan, at minsan, katatawanan. Welcome to Doc Guides. In this channel, I give tips, advices on skincare, aesthetic procedures, at iba pang pampaganda, as well as health and prevention, and non-surgical aesthetic superstar topics just like this one. So if you're new here, make sure to subscribe at sana marami kayong matutunan. Okay, threads naman tayo. This is a very broad topic. So, isa-isahin natin, okay? First, what are dermal threads nga ba? Oo nga naman, Dok. Ano yan? Sinulid? Uy! Hindi ah! Ito ay threads formulated to be used sa skin natin. Almost the same as the absorbable sutures na ginagamit in surgical procedures. So, natutunaw to. Pero hep, may magical feature to. I'll tell you later. Okay, threads are usually made of PDO or polydioxanol, PCL or polycaprolactone, or even PLLA. Doc, TMI. Too much information. Okay, you don't need to know much of this. Pare-pareho lang sila ng purpose at absorbable. Iba-iba lang ang tagal ng effect nila. Hence, iba-iba din ang presyo. What you need to know lang naman is, ano nga ba ang function ng threads? And para saan nga ba mga to? To know this, kailangan nyo muna malaman na maraming types of dermal threads. And iba-iba yung function nila. Tulad nito, may mahaba, maiksi, may barbs, may smooth. Ayoko nang buksan yung iba kasi gagamitin ko sa patient mamaya. Medyo malaking topic ito. So again, as I said, isa-isahin lang natin. Okay? Okay. Explain ko muna ang function at purpose. Since as we age, as explained sa video dito, collagen structure natin na parang net nasisira na or it breaks down while age catches up. Kaya bumabagsak ang mga structure. Ganito. Dermal threads can help support, revitalize, stimulate ulit yung collagen network ng skin natin, preventing and even reversing the effects of aging. So, pag nag-breakdown na ang threads, collagen formation develops. Ito yung physiological and biochemical aspect niyan. Usually, these threads are mono, spiral, or the smooth ones. Ito sila. Now we go to the specialized threads. Ito yung may mga barbs. Parang barbed wire, Doc? Yes, ganun. And yung iba, tawag nila yung fishtail. Parang banderitas, Doc? Yes, galing mo ah! And some are called the marbled threads. Parang... Tama na. Magaling ka na. Ako na. All of these, iba-iba man ang purpose at area ng treatment, may main purpose sila, which is mechanical support. Yes, pwede nito hilain and tighten yung mga areas that needs it. Like sa lower face, sa cheeks. Ngayon, the trending thing is the eye area and the eyebrow area, the popular cat eye lift. Nandyan din yung ponytail lift or the fox eye lift. More on that sa dedicated video about them. Yun! Medyo gets nyo na sana. And may other purpose pa ang threads, especially yung mga specialized ones, which is to volumize. So, nandyan na yung nose threads ng non-surgical nose lift. Nga pala, aesthetic doctors lang ang gumagawa dapat dito in the Philippines. I'm not that familiar sa regulations sa ibang bansa, pero I would strongly advise na sa licensed MD kayo pa-handle. Illegal practice of medicine is not good. More on that on another video. Okay? Okay, balik tayo. Sa nose, since you need a lift, volumization ang purpose ng threads. And at the same time, it also creates collagen and fibrous tissue formation. And may mga bagong technique ngayon which is offered to those certified doctors din. Yung Immortal Eye Thread Lifting. Bagong technique yan to treat the sunken under eyes. Kailangan ko na. Ganito yan, oh. Shout out to Dr. Spark. So kung fillers can last mga 6 to 8 months, this eye treatment can last you more than 2 years and also has a bonus effect of collagen stimulation. Kaya mas maganda yung result. Oh, galing ng threads, no? Kaya isa yan sa mga favorite kong procedures. Thread lifting. Punta naman tayo sa bad part. Complications. Siyempre, just like fillers, kahit non-surgical, may complications pa din siya. You're still making a break on the skin. So you're still invading the barrier protection ng human body. At sa areas pa ng danger zones ng face and neck. Kaya nga, dapat talaga licensed aesthetic doctors ang mag-administer ng procedures. Common complications, syempre, infection, bruising, nandyan yan. Those can happen. But it can easily be treated naman. Like infection, mape-prevent yan ng antibiotics. Bruising, a little ice compress will solve it. Specific complications ng threads. Kasi still, these are foreign objects sa katawan. So like implants, it can migrate or lumipat sa ibang area kaya may tumatabingi. Or thread extrusion, lumalabas na yung thread sa skin. Ganito. Don't worry. As long as licensed aesthetic doctor ang nag-handle at hindi lang non-doctor na tusok lang ng tusok porket may seminar na inattendan. As long as aesthetic doctor ang gumagawa, alam niya what is supposed to be done, what area, what layer, what anatomy, what physiology, and what biochemical process. Na years na napag-aralan at hindi lang ilang araw. Mape-prevent itong mga complications na ito at the minimum. Now, I'm not saying perfect kaming mga doctors. Pero at least, if ever may problem, nandito kami. Properly managing you as our patients. So, ingat-ingat kung sino ang tinatawag nyo na doc, ha? Baka yan pa ang ikabulag ninyo or permanent nerve damage. What? Peace, love you. Peace, love you. Peace, love you. Other than this, mas favorite ko talaga ang threads sa mga non-surgical procedures. Kasi mas stable siya at mas matagal ang effect. And mas predictable. Oh, happy? Some additional info lang. Kasi common question to. Doc, if nagpa-threads ako or even fillers, kailan ako pwede makapagpa-surgery if gusto ko na? Ayan. Very common situation to. So, hindi lang sa nose, kahit sa chin, sa cheeks, sa forehead, makinig. Ideally, hahayaan na muna natin ma-absorb ang mga to. Or at least mga 6 months or more. Better if more than a year before magpa-surgical procedure. Actually, pwede naman earlier, like 1 month after. Susubukan lang natin alisin kung nandun pa yung threads. Pero, since ganon ang mangyayari, more trauma ang magagawa. Unpredictable ang magiging result and mas prone sa complications. So, this will still be your decision. Nandito lang kami, ako, to explain and make you understand the possibilities, options, and consequences. Okay? Lastly, masakit ba to, Doc? Basically, do I look in pain ba dito? Yung first injection lang naman ng anesthesia talaga ang pinakamararamdaman nyo. Other than that, you should be comfortable. And meron din topical anesthesia. Oh, yun lang muna. Isa-isay na lang natin focus ang areas regarding thread lifting. Kahit small video contents lang. Sana may natutunan kayo. So, ready na kayo magpa-threads? Stop aging, guys. Take care of yourselves. If you want to inquire about my rates, go to the FB page and look for the Services tab. Chat kayo doon if you have other questions. Nga pala, make sure you're only transacting with my clinic. Ingat-ingat sa mga fake at scammer names ha. Nakapost sa clinic pages ang mga contact details. I always do official video calling pag confirmation na ng procedure and schedule. Para sure kayo, ako yung kausap nyo. The links of the clinic pages are in the video description. Ulitin ko, the links of the clinic pages is nasa video description. Palabasin nyo. Click nyo yung small triangle para ma-reveal. Or yung show more, syempre. Tanong kayo ng tanong, tapusin nyo yung video. I'm glad to see you again, guys. Happy New Year. We hope to have a good New Year ngayon. Medyo alanganin pa. We still have the pandemic. Pero hopefully, sasamahan nyo ako sa mga bagong content natin. And if you haven't subscribed, subscribe na! Pati bell icon. More videos to come kasi. Para una nyo malaman if may bago. Rhinoplasty series? Watch nyo muna. Baka nasagot ko na yung tanong nyo. Like and share ha. See you sa next one. Bye!